Good afternoon, fellow Barbadians and members of the media. 2 weeks ago, February 12th, I had the honor to give you an update on the Ministry's management of the surge in COVID-19 cases. On that occasion, I announced that in order to move the country back to opening, the curfew will be lifted. I thank you for the responsible behavior and the way in which you have socialized and conducted business since the curfew was removed. We've had no spike in cases, and the positivity rate has been declining. I thank you again and encourage you to apply the same responsible behaviors as we continue in this COVID environment. In addition, I indicated then that 6-feet physical distancing rule would no longer apply, except where persons exercise together outdoors without wearing a mask. In all other cases, the physical distance remained at least 3 feet. I also announced the resumption of hiking, the restoration of pleasure craft and private chartered boats for private cruises, and cruises operating 100% of their authorized capacity. No restriction on beach activity in parks, cricket capacity at 80%, and allowed public service vehicles to increase the authorized number of sitting passengers from 75% to 100% while wearing no masks. While carrying no standing passengers and wearing their masks. Since the removal of the curfew, the Emergency Operations Committee has met 6 times. As you're aware, the AOC reviews the criteria such as scientific tools and benchmarks to analyze key trends and changes in managing any public health crisis. The advice of the Emergency Operations Center has always been based on the science and an acute understanding that we have to embrace economic and social recovery in order to sustain growth and development. As you will recall, when I spoke to you 2 weeks ago, I indicated that the factors which guided our decision-making were trending in the right direction. This continues to be the case. The positivity rate is now at 17.5%, down from a high of 26% 4 weeks ago, and the R-effective, the ability of the virus to spread, is below 1 at 0.72%. In addition, the 7-day cumulative cases currently standing at 514 per 100,000 population is trending downwards. The doubling time, which measures the growth rate, continues to increase, which is also indicative of the slowing of the growth of the outbreak. In fact, during the last 4 days, February 22nd to the 25th, the positivity rate averaged 17%. This tells us that 83% of all persons tested on a daily basis do not have COVID, an improvement of the 75% rate that existed 2 weeks ago. These factors indicate that the COVID situation in Barbados is under control and getting better. Schools have reopened and so far, and based on reports by the Ministry of Education, Technological and Vocational Training, this process has been relatively smooth, and there have been no cases reported to the Chief Medical Officer for investigation. This is a tribute to the cooperation and discipline of parents, students, teachers, unions, parents-teachers associations, and all other parties, and must be highly commended by the entire population of Barbados. As a responsible ministry, we will continue to take a steady but cautious approach, always taking the prevailing public health situation into account as we move towards a new normal in a COVID environment. I take this opportunity to remind Barbadians that we are still in a COVID pandemic, and case counts, while falling, still remain unacceptably high. Based on the Emergency Operations Committee direction, the Ministry of Health and Wellness has decided that the testing protocols be changed. Accordingly, the rapid antigen tests done within 1 day of arrival into Barbados will be accepted. This is expected to improve compliance by visitors. The rapid antigen tests are now being standardized as an entry requirement by many countries, including those in the region such as Jamaica, Grenada, St. Vincent and the Grenadines, and beyond our region in the United States of America, with Canada and the UK set to change their policy within days. Also, nasal swab and mid-terminate swabs will be permitted, in addition to the nasopharyngeal and oropharyngeal swabs. These measures will allow visitors greater ease and more seamless movement through our air and seaports. In transit, passengers who have a negative rapid antigen or a negative PCR test will no longer be tested at the Grantley Adams International Airport. Self-administered swabs, shallow nasal swabs, and saliva tests will not be accepted. Our port health management and the COVID teams continue to do an excellent job in detecting infection at our borders and reducing our incidence of infection on island. To demonstrate the point, COVID cases among travelers in Barbados for January and February up to the 22nd were as follows. In January, of the 16,002 positive cases detected in Barbados, 300 travelers were detected at the border, which represents a risk of 1.9%. Up to February 22nd, of the 9,204 positive cases recorded, 75 cases were detected at the border, which represents a risk factor of 0.8%. These positive cases are captured at our entry ports and are not able to contribute to our incidence of positive cases since they are immediately isolated. As a result of the process of detection and isolation at our borders, based on the cases picked up at our borders, there is zero multiplier effect from travelers in the community. This is instructive to note that based on internal analysis, imported cases, COVID cases, detected at our border represents less than 10% of the total cases on island. The Minister of Tourism, the Honorable Lisa Cummins, was briefed on these new entry requirements, and I'm pleased to let you know that the Ministry of Tourism and International Transport has already updated the change to the Barbados Travel Protocol on the Barbados Tourism Marketing Inc. website, and this notification was issued to our partners in the international market to encourage them to pack their bags and head to Barbados. Last Saturday, February 19th, I led a team consisting of representatives from the Ministry of Health and Wellness, the Ministry of Tourism, Grantley Adams International Airport officials for an on-the-spot review of public health entry requirements and concerns regarding congestion at gates 14 to 16. At that meeting, we agreed to reconfigure airport logistics and move away from gates 14 to 16. In addition, we reviewed the processes put in place for arriving travelers at the airport since the beginning of the pandemic, analyze data on different levels of sensitivities with different sample types and different tests. A follow-up visit was done by Dr. Anton Best, the Deputy Chief Medical Officer, and Dr. Ingrid Kommerbatch from the Ministry of Health and Wellness. Having further reviewed the processes and analyzed the flow of passenger traffic and arrival data for the port health purposes, the Ministry of Health and Wellness, in conjunction with the Ministry of Tourism and management at the Grantley Adams International Airport, have decided to make critical changes to improve the visitor experience at the Grantley Adams International Airport. These changes include the discontinuation of the buses used at the airport to transport persons from the aircraft to gates 14 to 16, the relocation of COVID inspections to the main arrivals hall, new passenger flow-through arrangements, the removal of banding except the red band for visitors exiting the airport and arrival at their quarantine location. Simply put, passengers leaving the aircraft will now go directly to the arrivals hall, present proof of vaccination and negative rapid antigen test or negative PCR test to the port health and COVID teams, complete the ED card, and exit immigration. Last night, due to a maintenance glitch, the Minister of Tourism and I, along with the CEO of the airport and other representatives of both ministries, had the opportunity to witness the enhanced arrangements put in place to ensure a more efficient visitor experience, which started last night. These improvements are intended to remove the worrisome situation of congestion that had been occurring at gates 14 to 16 under the old arrangement. Working together, both ministries were able to make critical changes to improve the visitor experience while satisfying port health entry requirements and protecting public health. The BIMSAFE application, an app used by travelers to upload their vaccine test results and ED information, continues to be a useful tool and is still a work in progress. Based on year-to-date information supplied to me, 96% of all arriving passengers who use the BIMSAFE app, or 43,332 out of 50,157 ED forms filed, did so using the BIMSAFE application. The benefit of completing the BIMSAFE app allows for a faster flow-through at port health and immigration. I wish to thank the teams at the airport, including public health nurses, the lab test validators, and the BIMSAFE team for their continued cooperation as we work together to manage public health entry at our ports. On a related matter, the Ministry of Health and Wellness has proposed some changes to the directive that will come into effect on Monday, the 28th of February. Wedding receptions will be permitted in accordance with the protocols. Dancing at weddings will be allowed. There will be no restriction on the number of persons attending weddings subject to the physical distancing requirements. The provision that no person shall consume food or drink inside a bar or rum shop will be removed. The work from home requirement will also be removed. Standing passengers will be allowed as specified and according to vehicle carrying capacity. The Ministry of Health and Wellness is no longer recommending business houses, churches, and retail shops to record the contact information of their patrons entering such establishments. However, hand sanitization and temperature checks must continue. I wish to make it clear that where churches and other places of worship are concerned, that there is to be no limitation to the number of persons who can gather for worship, but that the requirement for the 3 feet spacing, hand sanitizing, and mask wearing will remain. These same conditions will apply to funerals. As I indicated 2 weeks ago, once the return to school was successful, I would turn my attention to the reintroduction of sporting and community-based events. Yesterday, I met with the Honorable Charles Griffith, Minister of Youth, Sport and Community Empowerment, along with representatives from several other sporting disciplines. We listened to the several organizations present at that meeting and received their feedback in preparation for the phased reintroduction of sporting events. The Chief Medical Officer has indicated that the approach to be adopted will be a risk-based one, taking into consideration indoor versus outdoor activities and contact versus non-contact sports. As agreed at yesterday's meeting, the Ministry of Health and Wellness submitted the risk-based metrics to the Ministry of Youth, Sport and Community Empowerment for their examination in consultation with their partners and stakeholders. We also decided that the governing bodies for sporting organizations who currently do not have protocols will urgently develop and submit their protocols to the Ministry of Youth, Sport and Community Empowerment and to the COVID Monitoring Unit. We are working towards a purposeful reintroduction of sport within 2 weeks in a risk-based manner to ensure the safety of players and spectators, and my ministry will continue to work with the Ministry of Youth, Sport and Community Empowerment and the sporting bodies for the urgent reintroduction of sporting activities in Barbados. Although all indicators suggest that the COVID situation is under control and getting better, I must re-emphasize that personal responsibility continues to be critical to us maintaining control of the COVID situation and reducing the positivity rate. We are not yet into safe harbor, but we must maintain that spirit of cooperation and responsibility so ably demonstrated by all Barbadians to minimize the effects of this outbreak. As I've said before, all indications are that we will continue to live, work, and socialize safely in this COVID-19 environment for some time to come. Barbadians, like other human beings, have had to adapt their way of life to previous health and other challenges. We have done so successfully and have been able not only to survive but to thrive, grow, prosper, and develop as a society. I have no doubt at all that we can and will do more of the same to the ongoing success of our beloved native land. I thank you.